Please welcome AJ Adel to the stage.
Good afternoon, or if you're like me, good morning or good night, depending which time zone your body's at. Last day, I hope everybody had fun. I hope you shared our excitements for the future of healthcare. And I hope you don't hear me talk a lot. Today, I get the pleasure of presenting 4 leaders from 4 different continents with 6 time zones. Don't ask me about the math, that's what we came out with. The topic of discussion is AI on a global scale. As we're traveling around the globe and we're visiting our clients, we get to see the cool things they all do and they all work on. So today, I have the pleasure of presenting those leaders who are actually thinking about things differently, whether they're building a hospital or delivering care or just engaging with their patients. They have a different view on things. So I'm super excited to introduce them all on stage. Please help me welcome our guests. Russell, you're all over it. I already told them we're going to change the questions. But what I didn't tell them is we're all friends before anything else. And we all decided this is going to be the most fun session ever. So we're just going to chat just like we did in the green room with less of making fun of AJ kind of a thing. But you're more than welcome to do so. Let me start with you, Kathy. You come from King Faisal Hospital, a huge organization in Saudi Arabia, doing amazing things, serving 20% of the population of Saudi. And you're keeping the patient and the people at the center of everything you do. When you do that, when you put the patient at the center of your design, it's not always easy. Can you share, how are you guys doing that? And what's some of the challenges you're facing when you're actually just focusing on the patient?
So that's a great opening question. Delighted to be here from King Faisal Specialist Hospital. So the one thing we know is that even though we are largely an Islamic society, not all of our patients are homogenous. They're not a homogenous group. And as we think about how we design around patients, the first thing is really understanding what do the patients actually want? And how do we use the data that we have around our patient experience to tell us what's working and what's not working for them, and how do we factor that into the design of services. The other bigger problem, I think, is really moving from the rhetoric to the practicality. So we all say that we want a better patient experience, we want to build our services around patients, but the provider workflows need to change in order to make that happen, to facilitate that. And that's not always so easy to change when people have been doing something the same way for many, many years. So we are 50 years old this year, believe it or not. And some of our people might even have been there for nearly all of that time. And so getting those changes into practice, moving from the rhetoric of what we'd like to do to actually making the physical changes to the way that we work from a provider-centric model to a patient-centric model is one of the challenges we have. And then there is the question about the technology that supports that patient journey and the integration between solutions that actually makes that patient's experience very, very different. But we also think about it in terms of design. How do we design facilities to be healing and healthy environments as well? So we think about fine details like color and artwork and all of those sorts of things. But perhaps important to know about King Faisal is that we are a specialist tertiary organization, quaternary even. And so we see people who are really at the most serious stage of their disease. And that actually drives, for us, as we think about our patients, innovation, because we really want to do a great job for those patients. For many of them, we are their last port of call. And so it really drives a lot of innovation. It features in things like clinical trials. We actually are running about 48% of all of the clinical trials in Saudi Arabia are done at King Faisal Hospital. So it drives a culture of innovation and wanting to do more and better. But of course, there is the cultural change that needs to happen. And then there is also the technological workflows that actually support the kind of work that we want to do. So as you say, it's not easy work, but it's both culture change, it's technology change, and it's change that really focuses us on why are we here, on our why, and we really are there for the patients, and so we follow through on that as a philosophy into practice.
I've been visiting King Faisal for the last 15 out of the 50 you mentioned, and I've always looked at all the leaders have one thing in common. Every vision has the patient at the center of it, so that's amazing. Russell, every time I open my LinkedIn, I see you building a hospital.
Not me personally.
No, not you personally. Well, I do see you with the hoodie and the vest and everything. But you're also, down in Australia, you're changing healthcare and you're going in places where healthcare hasn't been before. But you're also doing it while keeping the patient, the people at the center of this. Can you share, same question, can you share your vision?
Yeah, as you say, we're quite fortunate. Why build one new hospital when you can do two at the same time and two little ones, so 4 in total. But that's just because our population is growing so quickly. And for me, don't disagree with what Kathy said, but I'm going to come at it from a different angle. And as part of that build, we've seen the opportunity to put our patients and our staff at the center of how do you design a new facility. And that's been quite challenging because a lot of the guidance is written for 10 years ago. And our staff and our patients are imagining a new world about what they want and how they want the workflows to work. And that's been quite challenging, going against the sort of the building regulations. They're not true regulations, but they're sort of guidance notes, to actually put our staff in fabulous facilities with light and our patients in rooms with light, not the old hospitals we've got. So it's been great to be able to do that, and through the process, the technology has changed because, no offense to many clinicians, myself included, you cannot read a plan and imagine what a room will be. But with AI and modeling, you can kind of get a sense of how that will look. We were in a room this sort of size, and it was all on the floor, and you can move walls around. So using sort of technology in the design really allows us to put our staff and our patients at the center and actually them feel what that facility will look like. So our aim is that we get a much better facility that our staff want to work in, can work in, and our patients can be cared for in a very different environment that's healing and light. And hopefully they go home. They don't want to stay forever, but it will be a much better experience. And I think that's the important bit about how we can design new facilities and use technology to help do that, rather than just kind of go off a plan and go, well, that's what you get. Let's challenge that and let's get the clinicians and patients pushing for the same thing.
Yeah. You also had a couple of go-lives recently, and I remember you calling up and saying, we need this, this, and this, because the patient needs it. That's what I want, and I want that for them, not for me. Moving to you, Narav, the Bajaj Group is into a lot of things, but recently into healthcare. You've done, when we did the math, you've done 35 visits around the globe to multiple healthcare facilities, government entities, and beyond, looking at the best view of what the future look like. So in many ways, you do have a crystal ball. You can look into the future. What have you seen looking into the future? How does the hospital of the future look like as you've seen, as you design it in your mind? And I still remember the video you showed us on how things would look like. You're literally doing it from scratch based on the previous experience of others. Would love to hear from you on the hospital of the future.
Firstly, thank you, AJ, for staying on script. So the way we look at it, we've been to 4 continents now. We've been looking at all the different so-called best facilities in the world. The way we've structured our organization is we want to focus on prevention and be proactive rather than reactive. And I think that that's something that honestly is what the future is. Because you want people to stay healthy, you want positive health rather than dealing with people who are unwell and get them to that stage. The other thing is it's actually an ecosystem. So I don't look at it as a hospital, I look at it as an ecosystem. To even get prevention and be proactive, you need to have them in the entire continuum. You have to build the entire continuum of care. So right from home to home and everything in between. And many people say that, okay, you're building clinics, you're building ambulatory, and that's a feeder to the hospital. The way we're looking at it is the hospital is a feeder to the clinics. Because the clinics are going to be in your localities, close to your home. You recover better when you're at home rather than when you're in the hospital. So we think of it as an ecosystem rather than thinking of it just as a hospital or as a clinic. And lastly is, I think that it's going down the trend of personalized care and personalized medicine. And we look at it even from the logistic point of view. So why can't we, for example, we know when you've entered our campus, we've already allocated a parking spot for you. We already put you in the queue for your OPD appointment. And the same with IPD is why can't we have you already checked in to the room? Because we know you're on our campus, you'll be there in a few minutes. That's on the logistics side. On the medical side, each human, each body is different and reacts different to the same medicine. So why can't we understand what is your genetic sequence and see how you react to this medicine, whether it's through a digital twin, which of course now AI is playing a big role in, or just understanding you better emotionally and mentally. So that's how we're looking at the future of healthcare.
I think we're going to start calling hospital for the next 19 minutes the ecosystem. And I love what you said. It's going to feed the clinics, not the other way around. Mm-hmm. Russell, with the construction you all are doing, are you looking at things differently or?
Yeah, we are trying to. Hospitals usually are not places for community to come unless they're unwell. And we're trying to spin that to make our new facilities actually a community resource. I like ecosystem, I might pinch that one. But much more about the community can come in and not use the facilities, but get the benefits of the fact that a health precinct is there. And that's about sort of some message about primary prevention. There'll be GPs there, there'll be sort of primary health providers. We're also, and it's strange for an acute hospital to do this, but we're building kind of a new twist on a day hospital. So chronic condition patients can come in, they can get some peer support. So we've employed lots of lived experience workers, both mental health and physical health. We've got carer support workers that are carers themselves that have been through the process. You can see your clinician, you can talk to a peer, you can talk to AI, hopefully, if you can deliver it for me, AJ, no challenge. Can we have it yesterday?
He had to put that in there.
Got to do it. But it's about how do we actually get people coming in to try and get into that primary prevention space rather than have to come to an ED and get stuck in a system. So how can we get patients to engage, to self-drive their own care, to peer support, and become those future leaders in community, take messages out to the wider community. So we're careful about what outlets we let there in terms of food and dietary nutrition intakes. So I think we're trying to come at it slightly differently. It's a bit of a sort of experiment, but our community are kind of saying they want that and they want to sort of be in the hospital, but not in an inpatient facility, but just use that as a community resource to actually bring that health and well-being back into our communities.
Yeah, giving the patient the control and giving them the options.
I think historically, sorry to pitch in, historically, it's always been a place that you want to avoid versus making it welcoming.
Yeah.
And then it makes me think back to when your car needs service, you always go on time.
Yes.
But when your body needs service, you try to procrastinate and delay it until it's too late. So I think making it a welcoming space makes it a big difference.
Agreed. Speaking of making it work, Nicola, at the NHS, there's a lot of history, there's a lot of process, let's just say that. But every time I talk to you, you're thinking of new ways to deliver care. Mm-hmm. Can you share a little bit of examples of what new ways are you looking in to deliver care today as we step into the future? And is that making an impact to the patient, to the hospital operations? What's your view so far?
Yeah, sure. So as a Chief Operating Officer, I'm really interested in how we make not only the hospital but the whole healthcare system work more smoothly, but that is only for the benefit of the patient. So I often, when I describe my role, I say, the value that patients get is when they meet with their clinician. And the operational team and the logistics team are there to make that happen as smoothly as possible. So we're also building a new hospital. It seems like everyone's building a new hospital. And our hospital is also just...
We're going to call it an ecosystem. But
exactly,
yes, we're building a new ecosystem.
Well, I'll come on to that, actually. Our hospital is also currently just over 50 years old in West Suffolk. And we need to build a new hospital because there's lots of problems with the construction of it, and we've had to do a lot of remedial work. But when we're thinking about our new hospital programme, we've actually called it our future system programme, coming back to that system of care. Because in order to make a hospital run smoothly, we need the community services to be running smoothly, and we need to support patients to be able to get the same experience that they would experience in a hospital, but in their own home. So we've put in place a virtual ward, for example. We have used some remote monitoring technology, but some of it is also just about how we encourage people to feel as safe and secure as they do in a hospital. So yes, people put off coming to a hospital, but actually people also see it as a bit of a safe place. They feel safe, they can see the nurses and the doctors. And we want to create that same feeling, but out there in the community. So we already run community health services as well, so we have some experience of that, and we have a team called our early intervention team who take patients and go and visit patients who are diverted from ambulance calls. So somebody might call 999, as it is in the UK. That's triaged by an unscheduled care hub, and our early intervention team will go out and see that patient rather than a paramedic team, if that's appropriate. And what I'm interested in is, as we move forward, how do we use AI to perhaps inform some of that decision making and to automate some of that with the relevant safety checks in place as well, of course, but so that we are making the best use of our resources, so that we are protecting our high acuity resources for those patients that really, really need it and really need our emergency department care.
Well, we're definitely going off script now, in a good way. Kathy, I know for a fact King Faisal had Do No Harm initiative a couple of years back, which, back to what Nicola is saying, you want to make it a safe place. Eventually, you have to go to the hospital, right? And eventually, you have to be treated. But you want to make it a safe place. You want to make it a place where people feel comfortable being vulnerable, right? What's King Faisal doing to ensure new ways of delivering care? You're innovating. You're always sharing a new vision. Where are you right now?
So this is one of the best things about being at King Faisal, is that there's a huge ambition and a commitment to innovating for patients. And one of the things that we really focus on is how do we enable our clinicians to practice at the very tops of their licenses. And that involves removing from them parts of the workflow that could be done through AI or through technology. It also means for us keeping people at home, because we know that quite a lot of a lot of infections are acquired in hospitals. So as part of our Zero Harm initiative, our home healthcare is a big part of that. We know that for some patients, it is safer for them to be in their home environment than to actually be in a hospital environment, particularly because of the patient population that we serve. A lot of oncology patients. We have one of the biggest liver transplant programs or transplant programs in the world. We do quite a lot of high complexity neuro cases, etc. So we think about where is the safest place for those patients to be, and also how can we assure their safety when they come into hospital. Part of that is by releasing time to care, so using technology as an adjunct to enable clinicians to spend the maximum amount of time with patients. We have a very highly complex home healthcare service, where there are things that we didn't used to do at home that we now do at home. We do quite a lot of telemedicine, not just in the Riyadh area or the Jeddah area, but across the whole of Saudi Arabia. We provide support to many other organizations as well. Even at the interface, the front, the entry point to the hospital, the way that we use AI agents as part of our customer service model, that has been part of how we've created a more seamless environment for patients. But our goal is always also down to some of the very simple things that I believe many people here will be doing. How do we keep an eye on safety every single day? Our huddles are a great way of doing that. And as the chief nurse, of course, nursing is a huge part of our organization. We are about 40% nearly of the whole organization. Nurses are always thinking about what could we do differently to keep people out of hospital. So wound care is one of the areas that we're looking at matching clinician judgment with AI technology to see whether we can keep people at home, monitor their wounds at home without them needing to come into the hospital environment. The biggest thing that has happened for us recently is that there are many conditions that we used to send patients abroad for. People who needed CAR T-cell therapies. We've just manufactured our own CAR T-cells, have been able to treat our first patient locally, for what used to cost us millions of reals every year. And what that means is that we're then able to provide that for many more patients locally. So I think this is just the start, and that AI and technology and the solutions we have will enable us to go much further in the future.
Yeah, I can't wait to see some of the research that you're going to do on those patients. Nirav, moving to the Bajaj Group, the group is in many industries, and I'm sure you sit on multiple boards, and you get to see all the innovation going on in finance, going on in transportation, your sister organization, if I may say so. As you're building your new ecosystem, what are you seeing in other industries, like smart ideas, things that we can adopt in healthcare? And how do you see them playing a role in your future as a healthcare organization?
So thanks, AJ, for that. The way we're looking at certain things, right? One, it starts with culture. When it comes to culture, in India, a lot of the physicians are consulting physicians, which makes it's either you or me. It's not you and me. And when I look back at sport, which I played very briefly in my life, it's a team sport. And how can you actually get physicians, nurses to work together for the common good, for the common goal of the patient who comes out the winner, versus it's either your statistics or mine. So that's when it comes to sports. I see our group's values for almost a century now has been transparency and trust. And that can only come with information and openness. So, I mean, if you see it, which happens in the US, I'm amazed whenever I fly in the US and I get notifications about delays on my mobile. And I'm like, I wish that there was something as transparent when it comes to healthcare. And why can't we have possibly transparent bill estimators and live bill tracking? In India, it's still very fee-for-service and out-of-pocket. So we don't find out how much we have to pay at the end of the day until the final bill shows up. So instead, why can't I see along the way what's my out-of-pocket expense? So there's a lot of trust that doesn't exist in the healthcare ecosystem, which actually should be the most trusted industry.
Yeah, no, I think everybody agrees. We would love to get to that point. And Nicola, you also engage with multiple other departments in the UK government, education, transportation, and others. Are you seeing some of those innovations, and are you trying to, they say the biggest flattery is copying. Are you trying to see what can you copy into healthcare ecosystem?
Yeah, well, in fact, in the UK, we were lucky enough, a team of us from West Suffolk, to go to the Oracle Industry Lab in Reading. And I know the Oracle team were a little bit nervous about what they were going to show us there and thought, would we be able to translate this into healthcare? But one of the most exciting presentations when we were there was from the Red Bull Formula One racing team. And you might think, what's the connection there? But really it was their use of data in real time. And it really made me think about how could we apply this in hospital and community services. So what they're doing is they're using real-time data the whole time while the car is going around the track, while it's in the pit stop, and looking at what can they tweak to improve performance, but also running simulations constantly and using this single data layer to enable improvements all the time. In the NHS and in our trust, we have so much data.
Yeah.
So much data, and actually we don't face some of the barriers that other international health services do in terms of sharing that data. But even within our organisation, we have so many, millions and millions of data points, and we're not using it in that way. So that's what really inspired me as to how can we use that both on a patient level to spot what's going on for this patient right now, what's changing, because we collect it all, but do we use it to inform their care now and their care in the future? But also when you extrapolate that out to a whole emergency department, so what's coming in, how many patients need beds, how are we using all this to know what we're going to need to do in 12 hours time? But also when we're thinking about planning our new hospital, how could we run some simulations? What if we change this? What impact would that have? If we added a ward here, added an operating theatre here, what would the impact be? So that was what really inspired me. So from thinking, what's the connection with racing cars? There really are there's lots of things that you can learn from other industries.
Well, everybody from Oracle here loves you for saying that. Go ahead. Russell, maybe we stay with you in one more question, and then we'll open it up for the panel here. A simple one with a complicated answer.
There's no such thing as a simple question.
No, agreed. How do you see technology changing the game in healthcare? Let's just start there. What excites you about using AI in the ecosystem we're creating for the future?
I think it's the possibilities it's going to bring. It's the speed at which it will help bring insights, I'm going to call it, rather than information, to the fore for clinicians to treat our patients in different, better, faster ways. The stats about how quickly the evidence base is shifting is so quick, you can probably leave university now and it's out of date, or leave med school and it'll be out of date. So it's how we can enable our clinicians to give our patients the best care they can in that interaction, or over a series of interactions. And I think, part of that's about how we do that better than we are at the moment. I've got to stay very grounded because we still use faxes in Australia to send information around. So we digitize stuff, print it off, fax it, redigitize it. We can't share things by email yet because it's illegal. So I was kind of envious of what Nicola was saying about, sharing stuff. So it's nuts, but that keeps us pretty grounded around where we can get the technology to get us to. So it's going to be very pervasive and it's going to be really kind of challenging, but I sound like a bit of an old man now, which I'm becoming fast, but we really need to
I'm so tempted to make a comment there, Russell.
There you go. But the challenge for me is our clinicians need to keep that critical thinking. They can't just rely on the tech. And I think we run the risk of making it too easy that they just become taskmasters and they don't apply the judgment that we'll need them to continue to keep applying. And I think that's some of the challenge I see with the tech. It's almost getting too good that if we're not careful, generations coming through of clinicians will get to the point where they're not thinking, they're not applying that critical judgment, they just believe the tech. Now, probably 99% of the time it's right, but we really want our clinicians, as Kathy said, at top of scope, doing what they've been trained to do, supported by tech. And that's, I think, where we need just to be careful. But what we've seen this week is pretty impressive. I'm sure it'll continue to accelerate. The pace of change now is huge. It's just continuing to accelerate. So that's the exciting bit. And I think it's how do we keep pace with that in an industry that is often conservative and slow to adopt. Yeah. We've got to change that very quickly.
Yeah. Well, staying in that green room, and now we have all our friends here with us in the green room. A question for everybody, and we'll start with you, Nicola. When we all retire, and hopefully we retire in top of our game, we're going to look back and say we changed healthcare for generations to come. I think you hit on that a little bit, Russell. What's our role as a society here, as a healthcare society, from your perspective, and we'll go down the list. What's the role that everybody in this room plays in creating the next generation of healthcare for our children and our children's children?
Okay. I don't know what you know about my retirement. I'm hoping I've still got a job when I get home. I believe you can't be a leader in healthcare now without being a digital leader. But part of what we need to do are those leadership lessons that we all know, which is about genuinely listening to our clinical staff, our non-clinical staff, and our patients about what are the problems that they have that we have a responsibility to try and solve for them. So understanding how work really happens, not how we think it happens, that just because we've rolled out some tech, that everyone's using it and they're using it optimally. So really understand what's happening on the ground. And then from that, creating a vision, a compelling vision, and communicating that about how things could be. And from what I've heard the last couple of days, that is a really exciting vision, and the patient is at the center and it's patient-powered. And that's what people want, and that's what gets people fired up.
Beautiful. Kathy?
So I'm going to use a very sophisticated leadership term, but I'm totally stoked about AGI. And I am so excited about AI agents, particularly for clinicians. I think it helps keep us on our why. Why are we all in healthcare? We're there to add value. We're there to solve and to deal with the issues that really matter to people. And I know that health is absolutely wealth. It's the tide that floats all boats. And if our goal is to have healthy communities, healthy societies, healthy individuals, then we really ought to do everything that keeps us focused in that space. And that means leaning into curiosity about what is possible. I think technology offers us the opportunity to democratize leadership to where the best decisions are not always made by the people at the top. In fact, they're probably rarely made by the people at the top. But they're made in a more diffuse way across organizations where we can innovate really quickly and where we can involve patients in a really meaningful way and not involve them by inviting them in, but partner with them to deliver healthcare in a way that is very different and to receive and define healthcare in a way that's really different. So I have no plans of retiring right now. I'm 57. I'm planning to live to 115. That's my plan.
Well, I think you touched on something Nirav said, together, not separate.
Absolutely.
Nirav, Russell, final thoughts?
So I'm going to take a slightly tangential view on this one.
I knew it.
Maybe I'm not invited next year. But I think that culture is what really drives outcomes. The way the organization behaves and performs is the way that patients will actually feel and recover. So something that Tom said yesterday was quite interesting, is how patients believe that the AI was more compassionate and empathetic to the patients versus the physician. Well, I think that that's where the problem is we're a people business. We're not a patient business. So we need to take care of our people who take care of the patients. And I think that that's where technology comes in. And that's where AI comes in, is it builds in efficiency. And this is also probably a not so popular thing to say, is about efficiency in healthcare. But efficiency and empathy are always in tension, because empathy makes you inefficient and efficiency makes you not empathetic. But the reality is, if you can build in efficiency with technology at the back end to make your physicians, your nurses, and all of the staff who are at the hospital, at the clinics, actually spend more time and more care with the patients, I think that's what's going to drive real outcomes.
Beautiful. Russell?
Dangerous going last, because I've got to say something profound, which is a worry. I should have let Nirav go last. But I think for me, the leadership thing that we need to do for the next generation is to promote better change management, to embrace the technology. And I think as a leader, I've got to encourage and keep promoting risk-taking within whatever frameworks are, you have to comply with. But actually don't be afraid to push the envelope, to push the boundary, to take a risk calculated, probably better than just a wild one. But I think it's about keeping that ambition, because as I've said, it's people are coming to care for people. They want to do that job. They've got a passion for that. That's what we're in healthcare for. It's about serving that patient. But if we lose the ability to take a risk, to do a challenge, to push the boundary, we'll not improve care in the way that I think everybody wants to. Tech will help that, but let's take some risks in and around the tech.
I think what I got out of this is nobody's retiring in this seat, and we're all going to live to 150. I'll do one for you. I'm good with that. I want to thank everybody here. I want to wish you all safe travels back home, and for our audience, thank you for being with us, and thank you for trusting us and continuing to partner with us on creating the future of healthcare. Thank you, everybody. Appreciate it.